And good morning, everybody. I'm Mindy Buchanan. I'm the Director of Patient Programs at Foundation for Sarcoidosis Research. I'm going to give a thank you to our sponsors, Boehringer Ingelheim and Mallinckrodt Pharmaceuticals, making this event possible. From there, I'm going to hand it over to Dr. Megan Kennedy. She's a licensed clinical psychologist in the state of Illinois, and she works for the Edwards-Elmhurst Health System as a pain management psychologist. And Dr. Kennedy, take it away.
Welcome, everybody. I am just pulling up my slides, I think. Where did everybody go? Wow, 1 second. Okay, so I'm screen sharing. You're seeing, I don't know what you're seeing, so give me 1 sec. Stop that share. So technical difficulties in the beginning of a webinar are always fun. But I'm Dr. Megan Kennedy. I am a licensed clinical psychologist in the state of Illinois, as Mindy said. I work in pain management, psychological pain management, which we're going to talk about today, as well as other ways of managing pain and fatigue with sarcoidosis. So let me try again to share my screen. And it's closing me out for some reason. This is fun.
Well, we do see your screen. We see the PowerPoint.
You can see the PowerPoint? Okay.
Yeah.
All right. I've got some other Zoom screen popped up. So hopefully if I shrink this. All right, there we go. Maybe.
Well, we can definitely see your PowerPoint.
Awesome. Okay. And it has my name on the top of it. Is that where we're at for you guys? Wonderful. Thank you, Mindy. I appreciate your help. So I'm so excited to be here. As I mentioned, licensed clinical psychologist, state of Illinois. As of this week, I am a newly credentialed National Register Health Service Psychologist. So very exciting addition to my credentialing this week. I completed my doctorate at Midwestern University, which is in Downers Grove, Illinois. A lot of health psychology training, nursing homes, VAs, and that. And currently I'm working with the Edwards-Elmhurst Health System on pain management and with an integrated pain management team. And I'm on the opioid task force for our healthcare system. I'm so excited to have all of you here today. I understand we have quite a large crowd, so it's very exciting to be able to share this information with all of you. Hoping that we will you will learn some of the basics, causes of pain and fatigue in sarcoidosis, kind of some basic understanding of what's causing this, why is this happening, because we know that it's important. We know that knowledge is power, so that by knowing these things, you have the information and you have the initial tools to work with what you're dealing with. We're going to learn active and valuable techniques to manage your symptoms, whether pain, fatigue, or both, and hope to have some opportunities to discuss your thoughts, concerns, any personal experiences. There's a couple of slides where I'll ask for people to throw in information. Given the large size of the group, we'll just do that through the chat, which I'm going to set in off to the side. And Kevin, thank you for letting us know it's working good. I appreciate that. And let's get started. There is a chat box on the side. I will try to keep my eyes on it, kind of working through the slides, but you know, if anything comes up or any questions, I will try my best to keep an eye on that. So we're going to start with pain. Working in pain management for me has come as kind of a second career in my life. Actually, I was just explaining to Mindy, I'm a former elementary school teacher. So elementary school teacher turned pain psychologist. What a change. And as I was preparing for today, I was thinking about that journey for me and how I got here. And I think that's important to share because it shows that I've kind of been in the world and help people understand that I can understand what it's like to be in your shoes and what it's like dealing with chronic pain. As an elementary school teacher, I had an amazing opportunity to work as a homebound tutor, which means kids that were either too sick to go to school, whether it be physically or emotionally, having difficulties. I went into their home and kept them up with their schoolwork. So regularly in students' homes in the middle of everything that they were dealing with a chronic illness, chronic pain, and all that comes with that and the impact on the families. At the time, I didn't realize the impact that was having on my career, but I kind of see that as like the first steps into recognizing that this is an area that was going to become important to me. As I progressed through my career and my life, family situations, I had a father with Agent Orange disease and helped care for him through the VA, and a mother-in-law who was diagnosed with early onset Alzheimer's. So very personal experiences through my life to kind of help me develop empathy and understanding of the impact of physical chronic illnesses and the psychological aspects of those. Decided to go back to grad school in my later 30s and get my doctorate in my later life, later years, with younger kids, and decided that I was really interested in health psychology and specifically pain. Pain is everything. Pain is both that physical experience, and we're going to talk more about that physical experience that we have, that we feel pain. We know, I can say pain, and we all know what that experience is, and we all have different examples of what that is. But it's also an emotional experience, and as this slide kind of shares, it's an emotional experience. And we talk about physical pain very, I sprained my ankle, and it hurts. Pain, it's sharp, it's achy, it's stabby. But we also use physical describers of emotional pain. My cat is outside the door meowing, and he's being a pain in the butt right now. We use, let's see, what are some other good? My worry, I'm so worried, I feel it in my stomach. I have butterflies in my stomach, right? We feel emotional experiences through physical sensations. So the International Association for the Study of Pain, just back in 2020, has revised their definition of pain. And they've done so to include a more broad-based explanation of pain that covers more for us to understand. So they define it as an unpleasant sensory, so that physical sensation, and emotional experience. And it can be associated with or resembling that, associated with actual or potential tissue damage. There's a whole lot of words and a whole lot of confusing stuff, but it basically is saying that we're counting pain as any physical or emotional experience that may be related to, hey, I broke my ankle and there's damage, or it may be related to, hey, there's something else going on. We know that the neuron pathways and neuroplasticity can cause pain, a more chronic pain to develop. So that we don't necessarily have to have an actual damage to a tissue to see pain, or there's the potential for damage. So we'll kind of explain that, kind of how that looks with sarcoidosis as we go. More importantly, when they did this definition, they added on these additional qualifiers, saying that pain is always and I have this italicized because it's a personal experience. You may feel pain completely. We could have the exact same type of pain, but we may feel it completely different and describe it completely different. And you may have pain in the same place on 2 different days that are different. It's a personal experience. It's influenced to varying degrees by biological, so what's going on in the physical body, psychological, we'll talk about what that means in a couple of minutes, and then social factors. And I'm going to break all those down for you. Pain and the brain's sensory perception, what we call nociception, they're different phenomena. You may have pain, and it may not be detectable through what we have as sensory neuron detectors and studies. So it doesn't have to, we may not be able to see your pain, but your pain may still be very real. Through our individual life experiences, we learn the concept of pain. Some people learn that, pain is bad. I don't express pain. I don't feel pain, push it down, and I'm going to push through. Some people learn that, pain can bring attention and get them some needs met. So there's a varying degree of how we deal with pain, and culturally that can be very different as well. A person's report of an experience as pain should be respected. If you are reporting pain, you should not be treated as though you are, it's all in your head, or that it's not real pain, or we can't see it. Remember, because we said those nerves don't necessarily have to be sending messages that we can see, that should be respected. If you're reporting pain, it's real and it's expected, and it should be respected. Although pain usually serves an adaptive role, we're going to talk about what that means in a few minutes, it's meant to get us to motivate and change and do what we need to do to protect ourselves. It can have adverse effects on our function and our social and psychological well-being. So we may say, okay, I sprained my ankle, I need to rest it for a few days, I'm going to sit on the couch and rest. But then as time goes on, we sit on the couch and rest, and we notice that we're pulling away from social activities and physical activities that we enjoy, and it affects our social and psychological well-being. Verbal description is only one of several behaviors to express pain. We can say, oh, my pain's a 9, or my pain feels like a dull, sharp, achy, however we want to describe it. That might be one way, but inability to communicate does not mean that there is not pain. One can't communicate doesn't mean there is not pain. So these were important things that the International Association for the Study of Pain felt needed to be clarified. And I thought this was a good base to kind of get us going for today, kind of understand what is pain and why do we talk about psychological stuff with pain? Why do we talk about social stuff with pain? Because it is an important component of pain. So just going into the biological causes of pain in sarcoidosis, from what we understand, from some, pretty, sarcoidosis is a complicated syndrome, so it's a complicated explanation, but this is a very basic kind of explanation. So my non-medical learning about sarcoidosis, what ends up happening is when we have a well-working immune system, that immune system has white blood cells, or what we call macrophages. And those cells run throughout the body, and their job is to detect and kind of eat up the things that don't belong. And I'm sure we've heard a lot about this with the whole COVID-19 lately. The job of the body is fighting off the immune system is to fight off anything new that comes in, how it attacks, how vaccines work, all that stuff. So in that normal response, those white blood cells are finding, detecting, eating things, very simplistic way of saying it, but that don't belong. This is to protect the body from any foreign objects, bacteria, viruses, and it can protect from even cancer cells. Like the body sees something does not belong and it says, we need to get this out of here. We need to get this out of here now. Sends in white blood cells. Those white blood cells kind of eat them and get rid of them. Once again, simplistic explanation. But, we've got a little image of our athlete here kind of fighting off the different viruses and bacteria. When we're dealing with sarcoidosis, that immune system kind of goes into overdrive and it starts forming granulomas. And there's an image of a granuloma off to the side. A granuloma is groups of clumped up those macrophages, those white blood cells that have collected, eaten, and kind of taken stuff in. Well, they're supposed to kind of work their way through and leave the body. But then at some point, these are kind of coming in and clumping up and making big cells. They're clumping up with other cells and making this granuloma. You can see here it's filled with T cells, so that's part of the immune system. There's skin cells in there. All kinds of stuff just kind of comes in, clumps up, and we get this granuloma. when we see too many granulomas develop in an area or an organ, they can interfere with the structure and functioning. Let's picture that you have, well, let's just even think about the lungs. The lungs, we want to be open and wide so that air can pass through and pass out and do all the wonderful things that lungs do. Well, if we start adding these clumps of cells into the lungs, that's taking away from space. The question popped up, do the granuloma break up or do they stay big once that happens? From my understanding, in sarcoidosis, they stay big and they kind of the problem until treatment or it goes into remission, if I'm understanding that correctly. And Mindy, if you want to even jump in and kind of, if there's something I'm missing or something, please feel free to jump in and correct me on that.
You're doing fine.
Okay.
Yeah, so generally they don't tend to break up. So when you decrease the inflammation, they decrease as well, because when we're decreasing inflammation. So they don't break up necessarily.
Thank you.
I'm two non-scientists, so.
Super helpful. Yeah. Once again, because still kind of understanding the mechanism behind this, but this is, that was a really good question. So it's going to get in the way. It's going to interfere with structure and functioning. And as Mindy even mentioned, we're also going to get inflammation because this thing doesn't belong here. So now that immune system is starting to say, wait, we've got these cells that were supposed to be here to protect us that have now taken stuff in, and now they're making their own cells, and now the body's starting to fight these granuloma cells. So that this kind of ongoing process happens, and inflammation, because the body's like, we need this out. We kind of get caught in a loop of a feedback loop of let's see, and then with this, we can also get fibrosis that develops. So like it's the scarring of organs and tissue. So not only may you have the granulomas, but now we're going to get some scarring tissue in those areas from the process. So 90% of cases affect the lungs. And so but those can affect other areas of the body. We know that it can affect the lymph nodes, the brain and nervous system, heart, bones and joints, the spleen, eyes is another very common one, liver, many more. So anywhere kind of that nervous or the immune system is doing its job, those granulomas can develop. We just know that it's going to probably affect us more in these areas like the heart, the lungs, the brain, the nervous system, that just have a lot more impact on our life, the bones and joints. Yeah. So we've got this going on. We've got the body normal. We got the body's looking for any foreign objects, and it's going to get rid of it. With sarcoidosis, it's looking for it. It's trying to get rid of it, but then these granulomas are developing, and then inflammation and all this other stuff kind of goes on top of it. And I thought this was an important time to bring up this word homeostasis. Homeostasis is another word for balance. And the human body loves balance. It likes everything to be in a nice, balanced place. We like, if there's a germ in, we need it out. So the immune system's gonna jump in, do its work, and get it out. If the temperature is not right, it's gonna do, if the body temperature is not right, it's gonna do what it needs to get back in balance. If we're hungry, we're gonna seek food. Constantly seek out balance. If we're tired, we're gonna sleep. If we're wide awake, we're gonna get exercise so that we can balance it out. The world affects us in two ways, or the body is seeking balance in two ways. It's from both the outside, well, I'm sorry, I start with internal. So the inside world, right? So the image I have here is of high blood sugar in somebody with like a diabetes, right? The body wants to seek and find balance so that our sugar is not too high. We want to, like I talked about earlier, the temperature. So we're constantly, the internal body is constantly seeking balance in itself. But also the body is trying to seek balance in the outside world. We got a picture of our guy being chased by a saber-toothed tiger. When we're being chased by something, or when our body senses something is wrong, it goes into this fight or flight status to return us to balance. So that's the outside in idea. We go into fight or flight. So constantly seeking balance in our bodies from both our internal world and our external world. And that's to help us to stay alive. So how does this now kind of play back into sarcoidosis? The body recognizes that these granulomas don't belong and they work to start fighting them off. As I mentioned earlier, that's going to increase that inflammatory process, this inflammation. Damaged tissues in an inflammation, the damaged tissues release chemicals, and that increases swelling. So if anyone has issues with their joints, you might notice that there's more swelling in your joints because of the inflammatory process. We see that very much with like osteoarthritis, but I know that probably is common also with the sarcoidosis. Swelling is a protective response. It helps us to prevent further damage. So this is a form of that internal body saying, wait, something's wrong here. We need to get back in balance. I'm going to make sure that there's some swelling. So maybe you stay off your knee for a few days and let it heal and get back to normal. Once again, to help that body achieve balance. When that's in sarcoidosis, when it's not in remission, those granulomas can increase in size and amount. That inflammatory process is maintained chronically, like it lasts a long time in order to kind of get that balance, because that granuloma is there, we don't like it. So now we're going to make some inflammation so that it gets rid of it, which then causes more issues, and we get caught up in the cycle. And that cycle continues until it's either regulated with treatment or remission. So what does this all have to do with pain? We're going to consider a couple scenarios. So if you want to participate kind of in the chat, if you want to answer these questions, please feel free. But I've been also going to talk you through this if you guys don't, so don't feel that you have to. What are some things that you do when you're walking across the street? Just everyday, normal, you're crossing the street. What are some things that you would do while walking across the street? Let me give a second in case anyone wants to answer. And if not, that's okay too. Somebody says, look both ways. Very good. Anything else? Speed up. Okay. Watch your steps. Very good. Awesome. So looking both ways. Slow down. Okay, is another option. Stop, look both ways, and proceed. Perfect. And listen, very important. Good job, guys. All of these areas are super important because this is how our body is taking in information from the outside world to keep us safe. If we were to step into the street without slowing down or looking both ways to proceed or listening or whatever ways that we've learned to keep ourselves safe, something might happen. I even liked how somebody even said kind of watching your steps, if there's a curb or whatever. That's coming next. And why do we do these things? I kind of just gave that away, but if anyone wants to throw in why we do these things. Great. Safety. Safety is exactly it. We do this to keep ourselves safe. And protection, great. So what if you're stepping into the street and you twist your ankle? So you're walking across into the street and you twist your ankle. Now, would you want to know that you twisted your ankle? As you're stepping into the street. Okay, somebody said they've done it and they crawled to the side of the curb. Yes, and I'm getting yes. Yeses. You would want to know that you twisted your ankle. Because somebody says they would want to know what to do next. Good. How would you know? What would tell you that you twisted your ankle? Great. Katie says pain. Perfect. You would know through pain. Now, what if you twisted your ankle stepping onto the street and a bus was coming at you? Yeah, you might have pain and loss of balance. That was good, Ron. If you were stepping out into the street, twisted your ankle, and there was a bus coming at you, would you want to pay attention to the bus or your ankle? The bus. Perfect. Bus, bus, bus. Everybody's saying bus. Good. Good. Yes. So this is really cool because remember, back to that homeostasis stuff and the body wanting to keep us safe. Our brain is also involved in our body because it is in there, right? I think actually I've had brain scans. It's in there. I've seen it for sure. We know the brain's in there. The brain's in there to protect us. The cool thing with pain is that when the damage happens, so we're crossing the street, the ankle gets twisted, if everything's safe, a message is gonna, well, I should say, no matter what, a message is gonna travel from the ankle up through the leg to the spinal cord. The spinal cord takes that information and carries it up to the brain, the lower part of the brain. And the brain then has to kind of decide, am I safe or am I in danger? And if it feels like, okay, we're safe, it's going to send a message back down through the spinal cord, back down through the leg, back down to the ankle, and you're going to feel the pain in your ankle. But once that bus is coming at us, the brain's going to say, wait, just like you guys all said, that bus is more important right now. So we're going to hold off on this pain thing until you can get to safety. So it kind of holds back the pain for a couple minutes, lets you get safely across the street, and then the pain would kick in. Okay, this is kind of the normal process of pain. So it has to determine if you're safe or if you're not safe. And if it's an okay situation, then it's going to allow you to have the pain so that you can heal the ankle so that you can get back to balance. Does that all kind of make sense? Does anyone have any questions on that before we move forward? There's a basic understanding of pain and safety. Awesome, thank you, Anne. Okay. I'll try to move. So pain is helpful, sort of. We have adaptive pain and maladaptive pain. Adaptive pain tells us that something is wrong inside of us, or inside of us. It can be physical, it can be a feeling, or it can be a physical feeling or an emotion, or sometimes both. There's a phrase, the reign of pain is mainly in the brain. The idea is, remember I talked about that signal travels up to our brain, and our brain has to determine if we're safe and whether it's going to send a pain message back down. So people say, yeah, your pain's in your brain. Well, yeah, but not in the way they're making it sound. They're, sometimes they make it sound like it's you're making it up, is how they make it sound. But no, the pain signal does come from the brain and it travels back down through the body. So signal of danger goes up to the brain, signal of pain comes back down from the brain. So pain does come from the brain. It's not in the way people mean it. So that's where it's adaptive. That's where it's helpful. That's where it gets us to help us in our lives. Maladaptive pain is when it gives danger signals when danger is not there. And I have a smoke detector here. And I don't know if any of you have had this experience, but cooking in my kitchen, just making some eggs on the stove, and I've got a super sensitive smoke detector that goes off just because I'm cooking on the stove. Not even burning anything, just cooking on the stove. Smoke detector doesn't really need to be going off at that point. We are not in danger. I'm just cooking on the stove. I know I'm not in danger. Pain works the same way. Sometimes it's sending a message that says, hey, this is good, or this is not good. My ankle's twisted. You twisted the ankle in the middle of the street. We need to do something. We'll probably stay off of it for a couple of days, put some ice on it. Maybe we need to go get it looked at. That's where it's adaptive. Maladaptive is, I'm sending, body and brain are sending this message that isn't helpful. And that's what we see with a lot of chronic pain patients. The thing is healed, or the issue is at least kind of is stable enough. And that brain has now kind of learned this pain. And that's what neuroplasticity is. Neuroplasticity means that there's a signal that's developed between the body and the brain that's almost kind of gotten hardwired. And so we can learn to be in pain. And there's more when we're dealing with chronic pain. Sarcoidosis is we're also dealing with inflammation, but this is important to know because sometimes pain is helpful and sometimes it's not. It's not always a sign that we're in danger. And that, I think that's really important for you guys to understand. I've got a little video on what your brain is like on pain.
Dr. Kennedy, we're not hearing it.
Oh, I'm sorry, what was that?
We're not hearing it. If you stop your share for just a second and then share it again, when the share screen comes up, there's two boxes at the bottom that you need to click so that it shares your sound as well.
Okay, cool. Thank you.
Yep.
Yep. And now get out of here. See the little boxes.
Oh, it's right when you first share your screen, when you hit share and the option comes up
okay.
What thing you want to share. There's two little boxes at the bottom of that. And there's one that says optimize for sound and video and share sound.
Let's see. Hopefully. Oh, I see. Thank you.
Yep.
Got it. Okay. Oh.
We did have a request to start at the beginning of the.
Because the pain distract you from the task.
Absolutely. Sorry about that, you guys. Thank you for being patient. All right, all good there?
Yep, we're good.
Thank you.
Let's say that it would take you 10 minutes to solve this puzzle. How long would it take if you received constant electric shocks to your hands? Longer, right? Because the pain would distract you from the task. Well, maybe not. It depends on how you handle pain. Some people are distracted by pain. It takes them longer to complete a task, and they do it less well. Other people use tasks to distract themselves from pain, and those people actually do the task faster and better when they're in pain than when they're not. Some people can just send their mind a-wandering to distract themselves from pain. How can different people be subjected to the exact same painful stimulus and yet experience the pain so differently? And why does this matter? First of all, what is pain? Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Pain is something we experience, so it's best measured by what you say it is. Pain has an intensity. You can describe it on a scale from 0, no pain, to 10, the most pain imaginable. But pain also has a character, like sharp, dull, burning, or aching. What exactly creates these perceptions of pain? Well, when you get hurt, special tissue damage sensing nerve cells, called nociceptors, fire and send signals to the spinal cord and then up to the brain. Processing work gets done by cells called neurons and glia. This is your gray matter. And brain superhighways carry information as electrical impulses from one area to another. This is your white matter. The superhighway that carries pain information from the spinal cord to the brain is our sensing pathway that ends in the cortex, the part of the brain that decides what to do with the pain signal. Another system of interconnected brain cells called the salience network decides what to pay attention to. Since pain can have serious consequences, the pain signal immediately activates the salience network. Now you're paying attention. The brain also responds to the pain and has to cope with these pain signals. So motor pathways are activated to take your hand off a hot stove, for example. But modulation networks are also activated that deliver endorphins and enkephalins, chemicals released when you're in pain or during extreme exercise, creating the runner's high. These chemical systems help regulate and reduce pain. All these networks and pathways work together to create your pain experience, to prevent further tissue damage, and help you to cope with pain. This system is similar for everyone, but the sensitivity and efficacy of these brain circuits determines how much you feel and cope with pain. This is why some people have greater pain than others, and why some develop chronic pain that does not respond to treatment, while others respond well. Variability in pain sensitivities is not so different than all kinds of variability in responses to other stimuli. Like how some people love roller coasters, but other people suffer from terrible motion sickness. Why does it matter that there is variability in our pain brain circuits? Well, there are many treatments for pain, targeting different systems. For mild pain, non-prescription medications can act on cells where the pain signals start. Other stronger pain medicines and anesthetics work by reducing the activity in pain sensing circuits, or boosting our coping system, or endorphins. Some people can cope with pain using methods that involve distraction, relaxation, meditation, yoga, or strategies that can be taught like cognitive behavioral therapy. For some people who suffer from severe chronic pain, that is, pain that doesn't go away months after their injury should have healed, none of the regular treatments work. Traditionally, medical science has been about testing treatments on large groups to determine what would help a majority of patients. But this has usually left out some who didn't benefit from the treatment or experienced side effects. Now, new treatments that directly stimulate or block certain pain-sensing, attention, or modulation networks are being developed, along with ways to tailor them to individual patients, using tools like magnetic resonance imaging to map brain pathways. Figuring out how your brain responds to pain is the key to finding the best treatment for you. That's true personalized medicine.
So, let's see. Sure. You guys can see the screen still, correct?
Yes, we can see the pain's not on my head.
Thank you. Okay. Oh, now it's okay. So as we mentioned earlier, pain is not all in, well, pain is in your head, yes and no. Remember, we talked about pain being very real. Everyone's pain should be taken seriously. That was one of the foundations of the pain definition. But it's kind of all in your head because that's where it came from. But remember, pain can have a purpose. But what do we do when there's no purpose to our pain? And this is where I like to talk about clean versus dirty pain. Clean pain is that actual physical sensation. When we were talking about twisting our ankles, that's that feeling that you have. That might be sharp, dull, stabbing, achy. We use that pain scale, 0 to 10, 0, no pain at all, 10, the most pain we've ever been in, right? I'm sure we've all heard it, to help us indicate that level of pain. But dirty pain is another layer to it. And this is where my job really comes in. And this is where other treatments and therapies besides just seeing a doctor to get medications come into play. Dirty pain is like the thoughts about the pain in the situation. Give the example of, gosh, if only I would have looked down, I wouldn't have twisted my ankle when I stopped on the street. How stupid was I, right? Like we would get really deep down and into our head and about our thoughts about it. The feelings would be like, I'm experiencing a great deal of guilt and sadness because twisting my ankle is making me take time from work. My family really needs the money. Like now we're getting feelings involved. And then behaviors, which would be, I haven't exercised at all since I twisted my ankle. I can't sleep at night, and I'm eating junk food for breakfast, lunch, and dinner, because I'm kind of trying to feed my pain to make me feel better. That's the dirty pain part of it. So we've got clean pain, physical sensation, but then we get this dirty pain that kind of seeps in and makes things really murky. And sometimes, patients will come in and they'll be sitting in front of me and they'll be like, my pain's a 10, doc. And remember, pain, we want to take it serious. We don't want to minimize someone's pain, but it's also really important to kind of understand, okay, what is your clean pain? Why, what does it feel like? What is that level? And what part of this might be that dirty pain kind of getting in there and mixing in there? When somebody's sitting in front of me, kind of sitting calmly, probably not a 10, because a 10 is going to mean we're going to the emergency room and things are really kind of bad, like kind of we're needing major intervention and help. So it's really important to be able to kind of, wow, my clean pain might be a 4 today. My back's a little sore, a little achy, but wow, when I start thinking about how bad I feel because I haven't been able to exercise in a few days, or because, gosh, I only have just not done that to my back. How stupid of me. That's where that mixes in and kind of adds on top because of the way the brain works with pain. So then we kind of want to go into the psychological causes of pain. Well, we kind of were with the clean versus dirty pain. We were kind of looking into that dirty part. But if you look at these two kind of cycles going next to each other here, we've got the physical pain, so that clean pain, and then the psychological stuff, the dirty pain. And they're kind of running alongside one another very closely. So, your physical pain might say, okay, I twisted my ankle, I'm not going to cross the street. So then my ankle gets weaker. And then I get more pain with less activity. Oh, I tried to walk to the corner and it hurt. Poor sleep comes into play because it hurt when I was trying to sleep, which then causes our pain threshold to be lower, like our ability to kind of cope with levels of pain decreases. Let's see. And then on the psychological side, our increased perception of pain. Gosh, the last time I went and walked down the street, my ankle hurt so bad, so I'm not going to do that anymore. So now we're going to develop some anxiety or fear of the pain. Gosh, if I do that, that hurt. I don't want to do that anymore. What am I going to do? So I'm going to stay home. It's going to reduce my social interaction, possibly isolate me. It's going to then lead to poor mood and depression. And we kind of, like I said, we have these two cycles kind of running alongside one another.
Oh, Dr. Kennedy, I don't know if
Sure.
you want to go back there. We have a couple questions in the
Sure.
chat.
Sure.
On that slide.
Let's see. Somebody can't see the slide. Is everyone unable to?
I think your chat box is right on top of the slide itself. So if you just move that off a little bit.
Sorry about that, you guys. Oh goodness. Now I just blew up. This is fun. Is that okay? Oh, because when I was on that last slide, you couldn't see. Got it. Okay. Sorry about that, you guys.
There you go.
Awesome. So yeah, so the two cycles going alongside. Fatigue. Somebody asked about fatigue. Would you say that this is the same for fatigue, that psychological cycle? Absolutely. And we're going to get into fatigue in just a minute, but there's very much a lot of this all kind of plays into the same areas because of how that inflammation affects the body, which then kind of on the physical side, got the inflammation affecting the body, It's harder for you to do things. You might avoid activities, or you might want to, take naps, which then makes it harder to sleep. So absolutely, those do kind of play in very similarly. And then we don't want to go out because we're too tired and all that stuff, or just not a lot of energy. Thank you, Mindy. So then social causes of pain in sarcoidosis, or just in general. We tend to withdraw from interactions with others. People don't understand why we're feeling this way or why we can't do things. I have a lot of patients talk about, like, I don't look sick, so people don't understand why I can't do things. Or they think, I've got a lot of patients who talk about that they think that people think they're faking it, whether that's truly what other people think or whether that's their perception. That's something that might cause people to withdraw from interactions with others. Pain is going to keep you from engaging in activities you once enjoyed. You're fearful of experiencing pain, so then you just don't do it. Once again, kind of going back into that misunderstanding of the disease from others. Well, if you're sick, you should be at home. Like, why are you out doing anything? Or I don't know, somebody just mentioned the worst thing anyone says, but you don't look sick. That's a big one I hear from a lot of people. Because what does sick look like? Like, how can anybody know what you're going through on the inside of your body? And I think, this even probably goes into Sandra Manley-Eichler's presentation, if anyone was able to attend that, on communication, being able to communicate how you're feeling. There's a great story about spoons. Is anyone familiar with, like, the spoon theory of illness? Has anyone heard that before? So the spoon theory is, from what I understand, is a woman was telling another woman about a story. A woman was out with her friend for dinner, and the two women were sitting in a diner, and the one woman had had lupus since her late teens, so a chronic illness since her late teens, and the other woman had been her college roommate. And so they're getting together, kind of talking, and the friend of the woman with lupus, living with lupus, said, I've known you through this illness. I was with you when you were sick in college. I remember watching you. How do you do it? How do you get through? How do you, like, get up every day and get out and do things? I'm glad to hear Heidi has heard the theory. Thank you. And hopefully I'm explaining this right. But so the woman with lupus kind of goes around and picks up spoons from all the diner tables and kind of makes it like a bouquet of spoons. And she goes, well, she's like, when I get up in the morning, it's hard, my body hurts. So that's taking a couple spoons. Just getting up out of bed takes a few spoons, and getting up to the shower and just getting through my morning routine. And now she's, like, down to half of her spoons, right? And then kind of through the morning hours, and those spoons keep kind of diminishing until she kind of hits a point in her day where she has no spoons left. So kind of using that as an energy or ability to kind of do things and cope with distress, those spoons represent. And she said, in some days, like, I'm out of spoons and I'm borrowing from, like, the next day's spoons, and I got to borrow spoons, and, like, now the next day I'm more tired because I've already used up those spoons. So she explains this to the friend, and the friend goes, wow. She's like, that's powerful. Gosh, it must be really hard to do things. And she goes, well, how do you show up and be here with me now? And she goes, because I save spoons for the things that are important to me. And I think, there's on so many levels. Somebody mentioned that sarcoidosis warriors never have enough spoons. Yes. I would argue any chronic illness, and especially kind of these invisible, like, we can't see what's going on. I think it's harder because you're using up so many more spoons just to hold on and, like, get through the day-to-day stuff, because it's hard to get people to believe you. So going back to communication, right, this idea of being able to communicate and explain what you're going through, or not being able to explain, or not having people understand you, is really another kind of adds to that whole pain picture. Okay. All right. So that was kind of a quick and dirty explanation of pain. Truly does impact every part of our life, especially when we're dealing with it on a daily basis. And pain and fatigue go very much hand in hand, and especially in sarcoidosis. I mean, kind of in doing my research on sarcoidosis, this is a very prominent symptom and feature of sarcoidosis. So I'm hoping that I can do justice in explaining fatigue. And actually, in what I was kind of looking at, there was a research study that kind of looked at sarcoidosis patients and distinguished the difference between fatigue and daytime sleepiness. And I found this even helpful because I think sometimes we're just like, oh, I'm so sleepy, but it's actually fatigue. Or we say I'm fatigued and it's actually sleepiness. So I really like how they differentiated the two and kind of talked about that. So I really wanted to make this part of my presentation for you guys. So fatigue, the word fatigue, it's these feelings of apathy or weariness, kind of that getting tired easily, can be kind of described as that heaviness, that feeling exhausted, that heaviness, like, oh my gosh, I don't even know I'm going to walk to the other side of the room. I just like everything's heavy and I just, mentally feeling exhausted. Like my brain, like brain fog is one that comes up a lot, right? Because the brain is just done. It's taken up so many of our spoons just to kind of get to this place that we're done, lacking that energy to do everyday things. And it might lead you to not do too much during the day. And an indicator that it's fatigue and not daytime sleepiness is that you may try to lay down, but you may not be able to fall asleep. You know, if any of you have just like, oh gosh, I'm so tired, I'm sure I'm just gonna fall asleep. Then you lay down to go to sleep and you're just laying there, like not sleeping. So that falls more under the fatigue definition. Daytime sleepiness is when we actually do fall asleep during monotonous, boring tasks that we have during the day, like sitting and reading or watching TV, or riding as a passenger in a car for longer than an hour, sitting up and talking to someone, or goodness gracious, waiting at a stoplight. And if you're feeling that sleepy, please don't drive. Sorry, somebody threw up a question about the spoon theory, so I kind of want to address it since we were kind of moving on and I don't want to go too far ahead. They said they understand what we're saying with the spoon theory, but the only part that confuses me is saying she saved her spoons. I've taken it easy for the week, preparing something on the weekend, and then come to the day, I will be so sick and tired and in so much pain, even though I would have done nothing strenuous and still can't go. No worries. Thank you for sharing that. That's a really good point, right? So we think that we're like finding these ways to adapt, but also during that week where you may be trying to save spoons, you might also be kind of working, and I'm going to go back in the slides a little bit, back on that cycle where I'm saving, and now maybe I'm because I've avoided activities, now I'm going into deconditioning mode. So my muscles might not be as strong. So now it's going to take less to kind of get weak. I was just reading something the other day that deconditioning of the physical body can happen, I think, within a week, but of the lungs and heart happens even faster. So, and depending on where you're affected with your sarcoidosis, right? If your lungs or your heart is affected, that's going to cause even more fatigue because those oxygenate the blood. Heart both. It oxygenates the blood, which causes energy. So, being very careful about avoiding and kind of preparing. And more, what we're going to talk about is like pacing, kind of, okay, I'm going to do a little bit and try not to burn off all my spoons, but kind of keep things more steady and balanced. And we're going to talk a little bit more about that later. I hope that made sense to that question. So yeah, difference between fatigue and daytime sleepiness. As far as fatigue goes, they found a 50 to 85% frequency rate. So 50 to 85% of people with sarcoidosis in the study that they did had symptoms of actual fatigue. So this heaviness, this loss of energy kind of feeling. Pretty high percentage rate. So definitely a factor in sarcoidosis. They're not sure exactly what the cause is, but they feel like there's a few different factors at play. Inflammation. So if the body is trying to fight off disease, right? So think about like if you have the flu or a cold and kind of how you're fatigued and run down because the body's working to get rid of that virus. That's happening on a regular basis because you're fighting off this inflammation from the granulomas and the sarcoidosis process. And then there can also be the presence of other metabolic disorders in sarcoidosis, type 2 diabetes, some anemia, any thyroid dysfunction. We know that those can also cause fatigue. So if those are present, they may also be at play with fatigue. We know that anxiety, depression, and stress can cause fatigue, right? If we're in constant fight or flight because we feel like the world is, or I shouldn't say we feel like the world is dangerous to us, or we're trying to protect ourselves in whatever situations we're in, our stress levels, our anxiety levels are going to be high, and depression in itself leads to fatigue. So any of those factors could be at play. Treatment-induced fatigue. So the medications that you may be prescribed or on can cause fatigue. There's the idea of small fiber neuropathy, which can cause fatigue. And then any sleep disorders that might come along that say, okay, so now you're not even sleeping well because maybe you have sleep apnea, which is when you stop breathing at night in your sleep, which is actually very common with sarcoidosis. You might have restless leg syndrome, insomnia in general. So if you're having difficulty sleeping, it's now going to push into that next day and you're going to feel more fatigued. That just run down exhaustion. So like I said, they're not certain. Small fiber neuropathy, somebody asked, sorry, I'm trying to catch questions, but this one just popped up. Small fiber neuropathy causes fatigue. I feel like I might have a screen on this. Give me one. Oh, I looked into this. So small fiber neuropathy and fatigue. I'm going to need to get back on that for you. I might have an article to suggest on that one for you, or some more information, but I will need to get back to you on that one for sure. Small fiber neuropathy, the smaller fibers of the nerves are affected, and there's a lot more complication going on there, but yeah, I will share that with you. Thank you. Please remind me at the end, Beth. Yeah, so, and then the sleep disorders. So all of those can be at play. So even if you have a combination of any of these things, it's really why it's important to kind of pay attention. Like if you have type 2 diabetes, or if you have medications or a history of anxiety and depression, it's really important to pay attention to those and like talk to your doctor about them too, and mention, hey, I'm experiencing fatigue. It's also important to notice the difference between fatigue and daytime sleepiness so that you can go to the doctor and say, this is what I'm dealing with, and be able to clearly identify it so the doctor can be of more help. So then with the daytime sleepiness, that same study found that 26.6% of sarcoidosis patients had either daytime sleepiness or severe fatigue. So before we had 50 to 85% of fatigue. Now we're saying that they have the daytime sleepiness and severe fatigue. 16% reported excessive daytime sleepiness and severe fatigue. So, see, sorry, just got another question that I can pop into. Been diagnosed with sleep apnea and none of the masks are working. I'm exhausted all the time. What is suggested? Get in and talk to the doctor and explain to them that nothing's working, because there might be another treatment option that they can have for you, or sometimes, and actually I would even argue that there's even talk to your doctor, see what they can do, but even kind of working with a therapist to adapt yourself to the masks. We are not used to wearing face masks, blowing air in our face at night, so it takes some time to get used to. And there's some behavioral adaptation ways that you can work on, kind of like slowly getting yourself used to it. So A, start with talking to your doctor. B, seeing if you can talk to somebody who works in sleep psychology and to help you with kind of adapting to that mask or a mask. Because it's not fun having air blown up your nose or in your face. So it's a lot to get used to. And even if you talk to your doctor, they may even suggest like kind of starting at a lower level of air blowing at your face until you get used to it. So back to sleepiness, daytime sleepiness. So, okay, 16% of the sarcoidosis patients reported this, but in the general population, people without sarcoidosis, 2.8%. So we know that this is a thing also with sarcoidosis. So this is important to kind of know about. Some of the causes of sarcoidosis in this one, poor sleep hygiene. So this is another reason we're talking to a psychologist or talking to your doctor about your sleep habits is really important. Are you getting enough hours of sleep? Are you dealing with some insomnia? Do you have a hard time falling asleep at night? Do you have racing thoughts? Your brain kind of get really chatty at night. So that can be a problem. Medications. The steroids in themselves can cause people to be kind of alert during the day or at night when they're supposed to be sleeping. So primary sleep disorders, once again, that insomnia, sleep apnea, restless leg syndrome, and REM sleep disorders. REM sleep disorders mean that you're not getting into a good REM sleep, which is restorative. And that would be something to talk to your doctor about to see if that's a problem. And any difficulties breathing, right? That's also an indicator of severity of sarcoidosis. If those granulomas are in your lungs and you're having a hard time breathing, that's really going to affect your ability to go to sleep. Your brain's is going to be a little more cautious about wanting to go to sleep because of concerns of breathing. So making sure that that is taken care of is really important. Okay, so talked about what fatigue, what daytime sleepiness is, what pain is. I'm seeing some great questions up. Mindy, thank you for helping field stuff too. Somebody asked how good are sleep oral appliances. You know, with sleep apnea, it's really important that there are 2 and potentially more than 2 different kinds of sleep apnea. So it's really important that the doctor identifies what type of sleep apnea you have. If you have the type where the throat is kind of closing in on itself when you're sleeping at night, which is probably the more common type, then a sleep apnea machine might be good, or appliance to kind of get that propped open might be helpful. But if you're dealing with the sleep apnea that comes from the brain not sending the signal to sleep, which is a thing, then that's a different treatment altogether. So it's really important that they understand. And that's why those sleep studies are so intense, right? They got the EEG machines on you. They've got all on everything while you're trying to sleep, but it's really important that they get that information so they can treat the right kind of sleep apnea. As for sleep apnea, you can ask your doctor for a mentor who knows how to live with it. Awesome. I love that idea, Christine. Thank you. Yeah, and I'm going to admit myself, I'm a CPAP user. Staring at the machine over there. But it takes some getting used to. It definitely takes, some nights are better than others, but yeah. Nice job, Christine. 11 years at 95% usage. Awesome. Awesome. Yeah, because once you can get used to it, it can be very helpful. I love the idea of a mentor. That's great. All right, so what can you do? Let's see. Mindy, let's see. So there's is somebody asking this question, Mindy? Is there a relation between disease?
Yeah.
Okay, cool. Thank you. So somebody asked, is there a relation between disease intensity and fatigue? I have minimal amount of disease, but daily, fairly intense fatigue. I have no sleep problem at night. I'm currently not on any meds. That's a good question. So they do know that more intense, with the breathing issues, that fatigue and daytime sleepiness can go up. But like we said, there are so many other factors at play. It would be really important to make sure you talk to your doctor to rule out maybe any other conditions that are there, kind of leading to your fatigue, or kind of look at your daily routine, or even you may think you're sleeping well at night, and you may not even realize that you're not. We don't always know that we're not getting good night's sleep, or it's even funny. Sometimes I think I get a bad night's sleep and I end up getting a good night's sleep. So, it's kind of, those are some things to kind of look at as well. I hope that helped. Okay. So now what can you do? Because we're talking about pain, fatigue, daytime sleepiness, and daytime sleepiness management. And back to that question between the disease intensity and fatigue, maybe some of these techniques will also help with some of that fatigue. So I'm going to go back to that whole biological, psychological, and social stuff again, because I feel like it's a good way to break it down. And yes, Susan, the chronic pain does interfere with sleep. Absolutely. Absolutely. And kind of that fear and anticipation of pain plays into that as well. Number one, I think this would be my best advice. And hopefully you found a doctor that you're comfortable with, who understands your symptoms, understands your diagnosis, and is well-versed in sarcoidosis to help you through this. And if not, find someone who is, and make sure that you talk to your doctor. I think it's really important to keep track of your pain symptoms. And I shared a couple logs that you can download on here. Let me pull these up to show. I might have to, can you guys see my screen with the pain log? No, okay, it didn't work. Did you try the stop share thing?
Yeah, when you share again, it will give you the option to choose
Awesome.
a different screen.
Thank you. Okay. Now, hopefully you guys can see it.
Yep.
Okay, so this is a Living Better with Pain log. I like this. It uses pictures. I don't know, helpful, especially when you just kind of don't want to think, and when you don't feel good enough to think sometimes. So starting with pain, they have a stress indicator. So low stress to high stress, your daily exercise, activity besides exercise. Are you kind of watching TV a lot, in bed a lot, or are you kind of being active? Your sleep, did you get poor quality sleep? But then, did I have a rested one too? Do you feel rested in the morning would be another good indicator. Fear of pain, because that's a thing. If we're fearing pain, then that's going to make us think more, and it's going to add to that dirty pain. So kind of paying attention to where you are with that. Using your medications as prescribed. That's important. Any side effects you might have from your medications or from the symptoms. Any constipation. And keeping track of your sexual activity. Like, are you satisfied or unsatisfied? Your appetite, your mood, interactions with others or isolation, alcohol use, and finances. So I really like this one because it really does cover everything. Now, there we go. Oh, it popped up and it went away. Gotta love these computers. Sorry, guys. It's like stuck up in the top of my screen and I can't get it back. Shrink it. Oh, there it was. You guys are awesome. Thank you for being patient with me. If you have any questions coming up, please feel free to. Okay, are you back to seeing my PowerPoint?
No, we're looking at your website. So you'll have to stop the share and then reshare the PowerPoint. Yeah.
Cool. My home computer is different than my work computer, and we are just not getting along today. Wow. If any other questions are coming up while I'm fighting computers here, please feel free to share and I'll do my best to field those.
I'll go ahead and ask a question since you're working on trying to get your screen back up from the chat. So one participant is asking because her doctor has suggested trying stimulants like Ritalin to help with fatigue, and she's wondering, she doesn't like to take meds, and she's wondering if you've heard if this helps people with sarcoidosis.
You know, I feel like a study did pop up with that that I looked at. I think there were mixed reviews on that. You know, there's pros and cons. Goodness gracious, I can't. To taking those stimulants. First of all, whether a stimulant works, stimulants work differently on everyone to begin with. So that's an important factor to kind of be aware of. You know, one thing might be if you start low on a stimulant and see how you feel. My computer is completely freezing up on me. This is great. Yeah, I mean, so whether it's going to be helpful or not. Okay, you guys, I apologize. This is getting like, there's this little screen up on the top that lets me, or not lets me, like I can see the meeting controls, and when I try to click on it, it closes.
I can undo the share a lot, so you're not allowed to share anymore. It'll pop it back, I think, and then I'll.
Oh, that would be great. Please, thank you.
Yeah. There we go.
Awesome. I saw something up there.
Back, so you should be able to share again.
Cool. Thank you so much, Mindy. Oh. Talk about stress. All right, back to our PowerPoint.
We do have a question around how to avoid pain leading to depressive episodes.
Okay. So, first step is awareness. So we know that, kind of going back to that cycle, that if we don't engage in activities and we don't get good sleep and we don't, you know, kind of make sure we make ourselves and our self-care a priority, that there's a higher chance of depressive episodes. So being aware, paying attention to your mood, paying attention to, are you getting out and doing the things that are going to help kind of improve your life? And I'm going to also offer a couple suggestions in a couple minutes on that too. So hopefully those will help as well. All right, are you guys able to see my screen again?
We are.
Great. All right. So you're talking to your doctor, you are, I highly recommend talking with your doctor to develop a treatment plan. And the pain that you're feeling is going to be very dependent on the type of sarcoidosis that you're dealing with. And that's why, you know, some people might see a rheumatologist and some people might see a pulmonologist. So rheumatologist would be for your joints, pulmonologist for your lungs, cardiologist for your heart, neurologist if you've got the neuro. It's important that you talk to your doctor and work on a treatment plan based on the type that you have and the pain that you have. You might have musculoskeletal pain. So that's going to be, you know, sore joints, sore muscles, those kinds of pains. You can have that neuropathy, and like we talked about earlier, that small fiber neuropathy, kind of burning, tingling in the hands and feet, sometimes on the arms, other body areas. Chest pain from the lung pulmonary sarcoidosis. You might feel like a pulling in your chest area. And headaches if you're dealing with the neuro type. So keeping track of all that is really important, talking to your doctor. Your plans might include medications, and I've kind of made a list of the different types of medications that are used. They could use the corticosteroids. They might also use NSAIDs like Advil, Aleve, Voltaren. Antidepressants are sometimes used because they can help with nerve pain, as well as anticonvulsants, gabapentin, Lyrica, all very commonly used in helping with nerve pain. Topical anesthetics like a lidocaine or lidocaine patch, Those are helpful. And then a little bit on opioids. So these, we hear all over the news, right? We hear about the opioids. Opioids bad, taking them away from people. There is a time and a place for opioids. In an ideal situation, they should be used last. Like, okay, nothing else is working. We're going to do this to make sure a person is comfortable and okay. Or as a temporary option. You just had surgery. We're going to get you through the first couple of days because we don't want your pain to go too high, because then that's going to send your body into stress mode. So we want to keep that pain managed, but we don't want you on it for a long time. Opioids have a high potential for dependence, and that can lead to an addiction. So we want to be very careful with the use of these opioids. There is a place where these work and where they're important and they're very helpful. And then there's a place where they can be problematic. And how they can become problematic, right? We said addiction or dependence, but also they can make your pain worse in the long run, because that brain starts to crave that medication. When you initially take an opioid, you get, I won't call it a high, but you get a sense of relief, a sense, sometimes people even talk about a sense of euphoria. Brain likes that. It likes not feeling that pain. It likes feeling good. So it wants more of it. Well, how does it get you to take more? It creates pain in your body so that you'll take more. So something we really have to be careful with. There's a good purpose for it. It helps in a lot of ways, but we don't want to use too much or be on it for too long a period of time, if possible. And if it's not being managed by a doctor carefully. I have a video on here, time-wise. I think we're going to keep moving, and then I can always share that with you guys later. It's a good video on opioids, how they work with your brain. I kind of just explained it, so but it's a good one if you want to check it out. Oh. Pain management plans may also include kind of using integrative medicine and care. And I didn't throw on here, I thought about this later, talking to a dietitian as well. So using a dietitian, physical therapy, like getting movement back, right? If we've gotten weakened because of deconditioning or because, the joints have been stiff, we want to get those moving again, but we want to do it at a careful rate, and we want somebody to kind of supervise so we don't end up getting hurt more. So that's where physical therapy comes into play. Side note with physical therapy, it's going to hurt at first. I think people get scared of physical therapy because it hurts, but that's because you haven't used those muscles and things in a long time. So it's a careful kind of dance with you. You're going to hurt a little bit, and wanting to kind of keep it going, because the more you do, the less pain you should be in. Granted, now if you're having, ridiculous sharp pains and something got injured, that's another story. But occupational therapy, how to adapt to the world with any difficulties you're having. Some people, they make these great things that you put in your socks, and helps put your socks and shoes on if you're having back pain or bending issues. Speech therapy can be helpful, and that can be helpful especially if you're having breathing issues. They can help with breathing and retrain breathing. Acupuncture, and then like this healing touch, Reiki, those are all used to quiet down the nervous system. If we're in that immune system response and the body's always kind of fighting off the disease, the foreign objects, the acupuncture and the healing touch is going to kind of instill a relaxation response so that kind of you can bring it down a couple notches. And then psychological pain management, which I will talk about. My favorite question I get, why do I have to see a shrink? There's nothing wrong with me. Why do I have to see a shrink? And another little video here on progressive muscle relaxation. Maybe we'll save this if we have a little bit of time at the end. I want to try to leave some time open for questions and answers. So this is another one on breathing and muscle relaxation. That is great. So a friend of mine painted this picture for me, and this hangs in my office. And this is how I view therapy in the view of psychological pain management. The Emerald City in this picture represents our values and our life of values. And we are all striving to live the best life we can while we're here on this earth, trying to do the best we can with what we have, right? With the cards that we're dealt. But oftentimes when we're dealing with physical illness and pain and anxiety and depression and how all of those interact, we can lose sight of those values, or we can kind of come off our yellow brick road and get distracted from what's really important. You know, we start to think that pain is the most important thing in our lives, or that our illness kind of takes over, instead of like paying attention to what's really important, which might be our family or our friends or our careers or any of those things. So therapy, at least in my setting, we really work to identify those values and commit to the actions towards those values, in spite of whatever we might have with us, whatever we might be carrying, whatever pain, physical illness, depression, any of that we're carrying. We're going to take that with us. And if you notice, she has a backpack on. We're going to carry that with us, and we're still going to take steps down our yellow brick road towards our Emerald City. That's our committed action. We learn mindfulness and how to be present moment aware, so that we can pay attention to what our symptoms are and what we're physically feeling, and kind of pay attention to, am I in danger or am I safe? Am I safe? Is this clean or is this dirty pain? Cognitive diffusion is this idea that we get stuck into our thoughts and we think our thoughts define us and our beliefs define us, but learning to kind of step away and see them just as thoughts and just as feelings, and that they don't have to always mean what we interpret them to mean. Acceptance being that, okay, you may have pain, you may have sarcoidosis, but learning to accept it and move forward, right? I like to think of like that serenity prayer, serenity creed of grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Doesn't mean you have to like it, but how can you learn to accept it so that you can move forward to the things in your life that are important, right? Those values again, in spite of what you're carrying. And then the last, self as context, is just this paying attention to us and how we fit into this world, and how this sense of us has not changed, whether we have sarcoidosis or whether we have depression or anxiety, that the core of us is still here and still working towards those values. I do a lot of pain education. Information is key. It offers you options. It corrects misunderstandings. People come in, like we talked about, my pain's a 10. Well, like we said, if your pain's a 10, are you stuck in bed, can't move due to your pain? You need someone to take you to their emergency room. That's what we're thinking a 10 is, but maybe emotionally you're at a 10. And how can we kind of help with that part as well? Stinking thinking, once again, how do those negative thoughts affect us? Behavioral activation. Okay, I'm afraid that if I go for a walk, it's going to hurt. So kind of, okay, well, maybe we can walk 5 minutes today. Maybe we can walk 10 minutes tomorrow, right? Okay, that was a little extreme of a stretch, but taking our time and working on activating our behavior so that we can do the things that are important to us. Paying attention to the emotional impact of pain. It is real. It does affect us. And then encouraging self-advocacy. You should be the leader of your pain management and health team. Those doctors like to think they're in charge, but we are the only ones that know our body and know what we're feeling. And if we can kind of take control of that, that gives us a lot of, once again, that's something we can control in our lives. And hopefully they're willing to work with us in that. We also work on healthy lifestyles, working on sleep issues, smoking. If you're already having lung and heart issues, smoking is not helpful. Caffeine usage, relaxing, going for a walk in nature. The studies have shown that is one of the most healing things you can do. And even if just nature is, you've got a little courtyard outside and you can see, there was a study done I think it was on the Cabrini Green in Chicago, projects in Chicago, and how some had views into a courtyard and some had views into just like the city or whatever. And the people that faced the courtyards ended up having less stress than the people that didn't. Based on other things being equal, they were able to determine people who had a a courtyard view coped and did better than those who didn't. It's a very kind of quick summary of that study, but interesting though that we know that nature does help. Potentially losing weight and paying attention to what you eat, because food can cause inflammation.
Oh,
I kind of, yeah,
sorry,
go ahead. No,
a couple quick questions around that list that you just
Sure.
had. So we had some questions around how caffeine plays into pain, and then a follow-up question, not that that person saw that question, but a secondary question sort of around using caffeine or black tea not to be so fatigued so that you can get the exercise that's helping the fatigue.
Yes, yes. So, jumped ahead. Now I can't even pull up the top thing again so that I can see you guys, but, or see the chat. So I apologize for missing those. So here, I have a little slide on caffeine, just having to pop up. Coffee tends to have some anti-inflammatory properties. So caffeine can be kind of good, but, and there is some research that shows that caffeine can attach to pain receptors and decrease kind of that short-term pain, that acute pain. But it also can be a stimulant of the nerves and can lead to tension, twitching, anxiety, and activate that fight or flight system. There's some good, like you said, it can even kind of help. Well, and those green teas and those teas can even be better because there's even more anti-inflammatory. It's kind of little bit, I like the idea that everything in moderation, right? So if you can get a little bit to kind of help you through your day, granted, eventually you might need more to get you through your day, but if it can kind of get you going, I think that's helpful. But kind of looking at how much are you having and when are you having it, and talking once again to your doctor about what's best for you, and kind of keeping a log as well. Did this help me or is this harming me? But here's some anti-inflammatory foods and inflammatory foods. Caffeine's funny because it does a little bit of both. So, and it can be helpful. Smoking, some of the effects of quitting smoking, and how it can help over time. We're kind of running low on time, so I'm trying to be mindful of your time, everybody. Relaxation. With yoga and massage, I have be careful. Those are great tools. Some of these yoga classes are intense. They're hot, they move fast, and they have you doing extreme exercises. You want to be careful. You want to not go jump into the hottest, fastest class ever when you're just starting. You want to kind of ease into that. Same with massage. Yeah, we think it feels good to kind of get beat up and get all those muscles worked on, but that can end up causing more inflammation in the body. So you want to be careful with those two things. Music, art, socializing with others, water therapy. I'm an open water swimmer. I feel like being in the water is my happy place. So I'm a big advocate of that. And breathing exercises, just breathing. Just some good belly breathing. And if you have never learned how to do good belly breathing, I highly recommend Googling it, finding a YouTube video, finding education on it, or talking to somebody that can teach you. It turns off the fight or flight and turns on our rest and digest. So it's a very helpful tool that we all have in us at all times, and it can work us through pain. I mean, you think about Lamaze and natural childbirth, that's what they're using. They're using this deep breathing to get the woman to relax, help the woman relax so that she can move through the delivery process. Activity, super important. If we left a bike out, and especially a Chicago winter, it's going to rust and it's going to stiffen up. Same with the body. If we let it sit for too long, it's going to stiffen up. Our muscles are going to weaken, and the heart and lungs are going to decondition, like we talked about before. How do we prevent it? We want to pace our exercise. I don't want you guys going out and running 10 miles tomorrow, right? But if you can go for a 5-minute walk today and maybe plan to do 5 minutes a day, or break it up into 5 minutes 3 times a day, just doing something to keep your body moving, super important. You want to do things that are low impact on the joints. So running may not be the best idea. And most importantly, make it fun. You know, everybody tells us, oh, be active, exercise. And our natural instinct to that is like, oh, forget it. I just want to lay down and be left alone. When you can find something that's fun for you, would much rather see people do things that are fun for them than go out and feel like they have to run a half marathon so that they're doing what they're supposed to be doing. So find what's fun for you. And if that means going for a walk with a friend or sitting on a bike and watching TV in the house, do something. Start slow. Restorative yoga is wonderful. Walking, swimming, bicycling. All of those are low impact. I have a little thing here on sexual health. Sexual intimacy is an important part of your quality of life. When you're dealing with chronic illness, medications can get in the way as they can inhibit your sexual functioning, your arousal, your interest. You can also be afraid of harming yourself, and it might decrease your desire to engage in those behaviors. If you're feeling tired, sore, weak, probably the last thing you want to do is engage in intimate behaviors. We throw in feelings of inadequacy, any tension in the relationship, and maybe fear from your partner, like I could hurt him or her. You know, those are all going to play a part in this. What can you do? Once again, we're going to talk to that doctor, asking what you can and can't do in terms of these activity, and don't be afraid to ask. This is an important part of your life. The doctors have been trained. They can handle talking about sex. Sometimes, usually. Know your medications and their side effects. They might be affecting your sexual drive as well. Talk to your partner. Communication. What are your thoughts? What are your concerns? What are your needs? Engage other tools to help, whether it's, you know, toys to kind of get yourself going or any other things that might be helpful in that process. And most importantly, intimacy does not have to mean full sexual penetration or intercourse. That can mean cuddling. It can mean watching a movie together, hanging out together, you know, whatever that means to have that connection with someone you care about, and bring back that relationship if that's been taken away. Social media use. My 18-year-old recently told me, pro of social media, it's really easy to find people who agree with you. The con is it's really easy to find people who agree with you. Pros, it's a great source of information. Gosh, if any of us can think back 20 years ago that we would be picking up a phone and being able to find whatever we wanted at any time, or even just yelling at a machine in our kitchen that talks back to us. Creepy, right? We can make social connections, and especially other people living with sarcoidosis. You're not alone in this. We have amazing opportunities to connect, especially through this COVID-19 stuff. It's allowed us connections with people that we may not have been able to see in other ways. But it can be a rabbit hole of getting information. We start with one thing, and before we know it, we, you know, have the worst case scenario in our mind, and it's made us an anxious, fearful mess, right? It can pull people away from us who are right there in our lives wanting to be there for us. We can be talking to people who might be dealing with this, but then the people in our lives who are wanting to help us are kind of getting pushed away. Life is not lived behind a computer screen. We need nature, physical contact with others, and activity. So, final takeaways. I'm sorry I'm going over on time. You guys have been an awesome audience. And so sarcoidosis affects individuals in different ways. It can have physical, psychological, and social effects. Your pain, your fatigue, daytime sleepiness, those are all common issues that you may endure with it. We don't always know. There can always be different causes to these issues. I highly encourage you to talk to your doctor. Seek out a team of professionals to help develop your management toolbox. Educate yourself. Remain active. Sleep as best as you can. Relax and pursue your Emerald City. And here's some references to the things where I pulled from today. So I'm going to try to get back into the thing again. Still giving me a hard time.
I can turn that off for you.
Oh, I appreciate that. Thank you.
Yep. There you go. So
Wonderful.
we do have some quick questions if you're able to stay.
I'm okay. I appreciate everybody that stuck along with me. I'm okay to stay.
Great. Well, guys, if you do need to pop off, this is being recorded. So if you need to check the end of it, I'll be sending out this recording probably Monday or Tuesday. It takes a few days to get it up on a link that's shareable. But if you do need to go, that's okay because we're recording it. So the first question that we have is, can you, and just guys, I'm going to pose these questions to Dr. Kennedy, but keep in mind she's a psychologist and not a medical doctor.
Thank you. Yeah.
But so we have a question around what your opinion is on low dose naltrexone.
Yeah. So not sure. Yeah, I'm going to go with that one. I do not prescribe medications. You know, I know some things on the medications, but depending on it's very dependent on your type of pain, what you're dealing with. That's a question for your doctor, your prescriber.
Thank you. We do have a question on opinions also. Again, we're going to go back to this on THC and CBD products.
So in Illinois, it is legal. Yeah, well, medical marijuana is legal and so is recreational at this point. But in the United States, it is not. So this is a very sensitive topic. And I know even with the prescribers that I work with, there's a lot of concern about medications with opioids or using marijuana without opioids, I should say. There is, on the same note, I've been to some trainings and there are some good uses for marijuana. Everybody's different. And that's the other thing. THC is not regulated, so you may not get the same thing every time you get it. So be very careful. Talk to your doctor. But there are some studies that show it can be helpful, but be careful.
Great. We have another question around cryotherapy and whether that's good for pain.
Ooh. Okay, you guys got me on that one. So cryotherapy, would that be like ice?
Yeah, it's just like ice.
Yeah. Wow. So, I mean, ice helps with nerve pain. And yeah, I mean, sorry, you guys. I'm going to give you I don't know on that one.
Definitely throwing some more medical angled questions here, which, so guys, if you have some more mental health angled questions around pain and fatigue, that would be great. Please send those along. I'm just scanning here for some additional questions.
I appreciate that, you guys.
So we do have a question around it. It's very difficult to get in with your doctor due to the pandemic. Doctors are seeing 20 to 6 outpatient appointments. How do you suggest making a change when you can't contact your actual doctor?
Ooh. Seeing 20 to 6 outpatients. Oh, went from seeing 20 a day to 6 now. Oh, wow.
Yeah.
Reach out. Just I hate to say be pushy, but try to get in when you can. Or if there's a doctor that's really not that you can't get into, then maybe it's consider talking to somebody else, seeing if they've got other support within their office, maybe even too, or reach out. Yeah.
Yeah, so one way might be to just you don't have to transfer to another doctor. That can be very difficult when you have sarcoidosis, to have a bunch of different systems going on.
That's a good point. That's a good point.
But potentially talking, see if you get to the nurse at the doctor's office or a mid-level person at the doctor's office can be super helpful.
I agree with that.
Yeah. We do have a question around what is the best way to describe fatigue to our doctors?
So keeping track of those symptoms, what does it feel like? Are you dealing with more the heaviness? What time of day? What are you feeling? When is it, what is it keeping you from doing? Those are going to be some important factors. Going back to those scales that we looked at, those are going to be helpful so that you can keep track and bring that to your doctor and say, this is what I feel, this is when I feel it. So they can help you work with that. I noticed another one that kind of scooched up that was a good one. I thought if that would be okay, Mindy.
Yeah, go for it.
Where'd it go? Now I just went all the way to the top. Something about fatigue. How do you kick, so this was from Katie, how do you kick the funk of constant fatigue? Katie, you get up and move. Because when we get up and move, we hit that adrenaline releases, which is gonna actually kind of wake you up and stir you up. I know it's hard. I know our natural tendency is to want to stay down, and that's our brain and body kind of talking back and forth to each other. But when you actually do get up and start moving, your brain will say, hey, it may say, I kind of like this. Sometimes you got to push it into that. But the more you do it, the more adrenaline you'll release and the better you'll feel. Sorry, when you're ready, Mindy.
Yeah, so no, that's great. Thank you so much. So we have a question around, what do you suggest doing when you're not taken seriously? There's a lot of sarcoidosis knowledgeable doctors in my area, but one of mine has told me there's nothing more she can do for me.
Keep trying, keep being your own advocate. You know, if you know that you need more, and you know, just keeping track of your symptoms so that you can accurately go in there and kind of explain what's going on.
Yeah. And I would also say, you're free to get second opinions. If your doctors are feeling at a loss for what they're able to do for you, a second opinion might be an option. I know that's a really hard thing to look down the barrel of, because it was probably hard to get to that doctor in the first place and have someone who's knowledgeable. But sourcing out potential second opinions is also an option there. So we have some questions around understanding how does chronic stress manifest as physical symptoms in someone with sarcoidosis?
Whew. That's going to be hard to tell the difference between, because they're going to look very similar. In both situations, you are triggering the autonomic nervous system into a fight or flight response. When you're in constant fight or flight, which sarcoidosis will do and chronic stress will do, they are going to have very similar presentations. You're going to always be, your heart rate might always kind of be high, or your breathing might be very shallow and rapid. Your muscles are going to be tense. Those are going to be very similar. So we kind of treat those the same way. This is where that big diaphragmatic belly breathing comes in handy, because when you breathe from your belly, you actually trigger a nerve in the autonomic nervous system that sends a message to the brain and tells the brain, hey, chill out, we're good. The brain sends a message back down to chill all the stuff out. That's where relaxation, nature, all that good stuff comes into play.
Thank you. We have another question, and I'm going to give this with the preface that we have an entire session exactly on this topic. How do you get your friends to understand every day is a challenge? They get sick of hearing us, but what about getting sick of hearing them all the time? So just note to that person, we do have an entire session on effective and empathetic communication. I'm going to paste the link to that session video in our chat, but I'm also going to let Dr. Kennedy respond to that as well.
Friends, these are those times where, well, actually, it's interesting, because I was just reading some research about how sharing too much can sometimes end up being both problematic to us and to them. So finding what are the things you want to share, what about that relationship is so important to you, and finding those more important pieces to that relationship, instead of like, oh, I'm sick all the time, right? In the long run, what is the important piece of that friendship and that relationship that you'd rather be working on? Because remember, we're going to have that backpack with the sarcoidosis and your illness and your symptoms that you're always going to carry with you, but we're working towards reaching those values. So what is the value of that friendship? What is the value of that relationship? And what are things you can do to really manage that?
Thank you.
Yeah.
I think that is all our questions, guys. Oh man, there's a very big question.
Katie.
Wow.
Oh.
I'm going to let you read that.
Sure. So Katie's kind of dealing with some thoughts about, possibility of not having a remission, young, so working hard, a lot of stress. Sorry, I'm just kind of doing a quick scan, Katie, but I would recommend, it is nearly impossible to get an appointment with a therapist.
Yeah,
Okay.
so one big sum up there is that it's really hard to get an appointment with a therapist right now. That is a truth across the country and even
Yes.
probably the world right now.
Yes.
Um,
I'm booked beyond solid. And as are most of the people are referred to, which is really a sad state of where our country is at this point, or the world is at this point, that we're dealing with so much stress and that so many people, it's nice to see that people are reaching out to help, but that we just don't have enough support. And I would even argue in the area of pain management, there are less people available, but keep trying. There's somebody, just be patient. Look at online. There is a great, I think it's called Therapy in a Nutshell. It's on YouTube. So it's a therapy in a nutshell. I'm not, of course, I don't know 100% what but I've caught a couple of her videos, and they've had some really good topics that would be helpful even in dealing with some thoughts and feelings. So you could look at them. Once again, not endorsing, but maybe something to kind of hold you over until you can get into something.
Thank you. And I'll also add that FSR does provide Sarc socials, which are not meant to be emotional support programs, but they are meant to be community building programs that are hosted by our patient advocates. We do them twice a month. Joining them can be really helpful in finding common ground to talk about sarcoidosis. Again, it's not those sessions are not held by a clinical person like Dr. Kennedy or Sandra, who's done some of our other sessions, but is instead meant to be peer support and community building, which can help a lot, just being able to talk about stuff with other folks who truly get it. So that's also a free option that folks have.
Love that. That's a great option, because just talking to somebody else who's been through it, they've been where you are now, and can see, kind of give you insight on what may be coming and how they've managed.
Yeah. So thank you guys so much. Thank you, Dr. Kennedy, for your time.
So happy to be here.
So great to have you. Again, a reminder to folks, we will be sending out the slides in a PDF format for you to get. And this has been recorded, and we'll be sending out the link to that in the next couple of days, early next week. And with that, I'll go to Dr. Kennedy, and thank you.
You guys, thank you all so much for your time. I know we went over. I appreciate that. I hope there were some valuable things that you were able to take, and enjoy the rest of your Saturday. Hopefully everybody else has some nice weather where you're at. Thank you.
Thank you so much. I did have a quick question there. The Sarc social link, guys, if you go to our website, stopsarcoidosis.org, it's under the events tab. If you hit take action, the events will come up. You'll find all of them there. Sorry to add that at the last minute. Thank you again, Dr. Kennedy, for everybody coming.
Somebody's going to bed. Good night, Katie. Have a great afternoon or evening or whatever, but everybody, we'll see you soon. Okay,
thank you guys.
Thank you very much.
You're welcome. Thank you guys so much. Bye-bye.
Bye-bye.